Cysteamine Bitartrate Capsule is used to preserve kidney function and manage kidney damage in people with an inherited disorder that causes buildup of cystine in the body, nephropathic cystinosis. This buildup can cause problems such as kidney issues, slow growth, weak bones, and eye problems. Cysteamine helps the body get rid of cystine. The recommended dosage and best time to take this medication should be discussed with a healthcare professional. Before taking Cysteamine Bitartrate Capsule, it's important to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually 4 times a day. It's best to take it with food or just after a meal to reduce stomach upset. For children younger than 6 years, do not give the whole capsule. Instead, open the capsule and sprinkle the contents onto soft food such as applesauce or mashed potatoes. It's important to eat all of the mixture right away and not prepare a supply for future use. The dosage of this medication is based on weight, medical condition, and response to therapy. Your doctor may start you off with a low dose and gradually increase it to lower the chance of side effects such as upset stomach. Your doctor will also adjust your dose based on your cystine levels to find the best dose for you. It's important to take this medication regularly at the same times each day to get the most benefit from it. Some common side effects of Cysteamine Bitartrate Capsule may include nausea, vomiting, fever, loss of appetite, tiredness, drowsiness, and diarrhea. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as mental or mood changes, deep sleep, seizures, unusual tiredness, headache, hearing problems, dizziness, eye or vision problems, skin problems, bone problems, black or bloody stools, stomach pain, or vomiting that looks like coffee grounds. Cysteamine can often cause a rash, which may not be serious, but it's important to seek medical help if you or your child develops any rash. While a severe allergic reaction to this drug is rare, it's crucial to seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Cysteamine Bitartrate Capsule, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any inactive ingredients that may cause allergic reactions or other problems. Before using this medication, make sure to inform your doctor or pharmacist about any medical history related to liver disease or stomach/gut problems. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you can do them safely, and to limit alcoholic beverages. If you are using marijuana, be sure to discuss it with your doctor. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It should only be used when clearly needed during pregnancy. It's unclear whether this medication passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking this medication, it's important to follow the recommended dosage and take it at the optimal timing as prescribed by your doctor. When taking Cysteamine Bitartrate capsules, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's essential to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as any herbal products, and share this list with your doctor and pharmacist. It's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center for assistance. It is important to not share this medication with others. While taking this medication, it is important to have lab and/or medical tests done such as cystine levels, complete blood count, electrolytes, and kidney/liver function. It is important to keep all medical and lab appointments. It is best to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's less than 2 hours before your next dose, just skip the missed one and take the next dose at the usual time. Don't take 2 doses at once to make up for the missed one. Make sure to store cysteamine bitartrate capsules at room temperature, away from light and moisture. It's important to keep them out of the bathroom, and always make sure to store all medications in a safe place, away from children and pets. When it comes to discarding this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly dispose of the product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.